Today, we're honored to have Linda Roberts Heller, who's the administrator of the Leisure World Healthcare Center, and she's going to give a lecture called Leisure World Today and Tomorrow. And she's going to discuss the current Leisure World Healthcare Center and plans for the future. And she will introduce Mary Sherman, Dr. Mary Sherman, and she's the newest addition to the Healthcare Center. So may I present Linda Heller.
Put that green light on.
There.
Can you hear me?
Yeah.
Oh, good. Okay. I'm going to step aside from the podium a little bit because, as you can see, I'm not a very tall person. And I'm afraid that if I stand back there, you won't see me and you just hear this little voice coming over the podium. First of all, thank you very much to the Golden Age Foundation for inviting me to be here. You know, I am the administrator of the Healthcare Center. I've been the administrator since the 1st of June of this year. Prior to that, I was the business office director for 3 years, which means that I was responsible for the billing, our favorite part of the whole thing. And after that, then I became the administrator. Since then, we've gone through numerous changes. Tried to do some new things and some new activities and some new services. And we have some plans for new services for the future, some of which I sat and done some thinking about. And I'd like to tell you a few of those things. Currently, the services that we have now, which some of you may not be aware that we have, and then some of the plans that I would like to see come forth in the future. About a month or two ago, I took a trip back east to New Jersey, which is where my family lives. My mom and dad have moved into a community much like Leisure World. It's called Holiday City. And the only difference is that it's not a gated community. That anyone can drive through the streets, but you do have to be 55 or older to purchase a home in the area. And they have many of the clubs and the associations that you have here. One of the things they do not have is a healthcare center. They have to travel at least 5 or 6 miles up the road to see any physician or to go to a hospital or a rehab center or even for a pharmacy for that matter. And there's no transportation of any kind. If you don't drive or have a way to get there, it's pretty hard to get to a doctor. So while I was there, my mom became ill and we had to go see her doctor. And her doctor knows what I do, that I am the administrator of a healthcare center that primarily deals with senior citizens. And he asked me a question which brought me to some of the things I want to talk about today. And that question was, what is so special about the healthcare center that you're the administrator of? And the reason he asked me that was because he's a physician who 80% of his practice is built around the retirement community there. He was one of the first physicians down there, and so naturally he got most of the people as patients. So he has the largest population. Well, they're starting to feel a lot of what we already know in California here, and that's the arena of managed care, which means that you put aside temporarily your Medicare card and assign over your benefits into an HMO, and then you select a primary care physician and go through all those processes. Well, that's becoming very obvious now back in the East Coast, just like we have it here. And these physicians are not real sure how to deal with it, first of all, but what they're frightened of is that, well, what's going to happen to our patients? Are they all going to want to go somewhere else now? Are they all going to have to go somewhere else now? So they would like to keep their patients. So they asked me, what is so special about the healthcare center in Leisure World? What do you do that you would not normally find in a physician's office that's not connected with a healthcare center? And what do you do to benefit your patients? What are some of the things you do? So I sat back and I thought about it and I said, well, I'll give you a list of some of the things we do. And that ties in directly to what I've been asked to speak about today, is what do we do at Leisure World Healthcare Center? What do we have here? Well, let's talk about one thing that you normally don't find in a healthcare center, and that's the pharmacy that we have here. The pharmacy is available to all of the residents of Leisure World. How many people have seen the new pharmacy? How many people think it's much better than the other one was? Okay. It's quite beautiful, and that's because we have a very good pharmacy director. She is very progressive. She has gone in there and identified the needs of the community and said, well, you know, we need a few more things than just being able to give out prescriptions. We need to have a lot of over-the-counter things that people need. We need to have some aids that seniors would normally use. We need to have maybe a few little groceries. Anyone here ever have purchased any of the groceries there? I do. Because I'm lazy to stop at the store, so I'll go in and buy a little thing of tea bags or something in there, which makes it very convenient. And they have food in there as well. One of the reasons we put food in there is because we have a lot of people who come to the clinic early in the morning to have blood tests done. And most of your blood tests, you're required not to eat. Well, you have your blood work done. Maybe you had to wait a few minutes and you've now had your blood work done. And now you need to go home. Well, wouldn't it be nice to be able to go somewhere and at least get maybe a muffin or an orange juice or something before you go home so that you're not sitting there without anything in your stomach? So that was another reason. We put food in there for people. And I don't know how many of you know that, but they do have it. They have fresh muffins in there, and they have orange juice, and they have, the only thing they cannot carry in that, it's a health law, is milk. Those things they cannot have, but they do have juices and iced teas and muffins. They've also put a line of gifts in there. You don't normally find those things, and that's because it makes it easier. You need to buy a card for someone or a real quick gift. They try to look around and get opinions from people and see what are the things they most commonly would buy, and so they purchased those things. They went to the LA gift show and purchased a lot of those things, and you'll see for the holidays now they're going to have a big line in there. So we put those kinds of things in. The pharmacy also does deliveries. Will deliver your medications. If you are homebound and cannot get out to get your medications, when you call the pharmacy, you need to tell them that, and we do have a gentleman who will deliver the medications, and I believe it's in the afternoon that he will drop off medications for you. Well, what else do we have? Well, there's someone mentioned to me recently a misconception. They thought you had to be 65 years old to use the healthcare center. And obviously not everyone living in Leisure World is 65 or older. No, you don't. You can be under 65 as long as you are a resident of Leisure World. The services of the clinic are available to you. And I'm going to clarify this one point here. I have tried very hard over the last few months in any group that I talk to explain what that means. You're a resident of Leisure World. You're entitled to use the services of the healthcare center. The healthcare center does, from a financial standpoint, run very much like a doctor's office. If you were to go to see a doctor, let's say in the medical building next to Los Alamitos Medical Center, well, there has to be a responsibility for who is going to pay. Well, either you still have your Medicare as your primary insurance, and then you have a supplemental, or maybe you've signed up with an HMO like HealthNet Seniority Plus, or Secure Horizons, or SCAN or FHP. You want to make sure that the doctor you're seeing is a provider for those plans, so that you don't have an enormous out-of-pocket amount to pay. Well, the healthcare center basically operates the same way. All the physicians that come down there, first of all, they all accept Medicare. Secondly, we accept most of the supplemental insurance plans. We are providers for almost all of them. And thirdly, we have contracts with HealthNet Seniority Plus and Secure Horizons and PruCare One. Which means that if you fall into any of those categories and you come in to use the services of the healthcare center, then whatever insurance you plan you fall under, it's going to be covered. Now, there are other plans out there for which we do not have contracts with. Kaiser being one of them, FHP being another, SCAN being another. We have no current agreements with those companies, which means that if you want to come in and use the services of the healthcare center, that the plan that you have signed up with is not going to cover you. So therefore, you can still use the clinic, but now it becomes your responsibility. And I will tell you that in my almost 3.5 years of being here, I have seen several people come into the clinic and use the services out of what they call out of their plan for whatever their personal reason was. Maybe it was convenience, maybe they had no way to get to wherever they needed to go. And in turn, we have let them know up front that we'll be more than happy to take care of you, but we need to let you know that you're out of your plan or out of your network, and this bill is going to be your responsibility. And that now gives you, as the prospective patient, the choice of what you want to do. We've had many people say, fine, I don't care, whatever it is. I just need treatment right now. I've had other people say to me, no, I'd rather go to where I'm supposed to go. So it works both ways. But I wanted to clarify that, because when we say that if you are a resident of Leisure World, you can use the services of the healthcare center, we have to go one step further to let you know that we have to deal with many of the same insurance plans and benefits and authorizations and restrictions that most of your average doctor's offices have to deal with as well. So again, you don't have to be 55, you don't have to be 65 to use the healthcare center. We have quite a few people who are still working, who come in and use the healthcare center. We're providers on their plans, and they see our doctors. Also, you don't necessarily have to be seeing one of our physicians to use some of the ancillary services. Well, what are those services? X-ray, physical therapy, cardiac rehab, the lab. You don't have to be seeing one of our 5 primary physicians. You don't have to see any of our doctors in the clinic in order to use those services. We have quite a few people who come in and have just an X-ray done because it's more convenient. If they're seeing a doctor somewhere outside of the premises of Leisure World and that doctor doesn't have his own X-ray, they can come into Leisure World to get their X-ray done. And come in the lab. We have a lot of people who don't see any of our physicians at Leisure World and come and get their lab work done. And we send the results out. The lab sends the results out to whatever physician they need to go to. We have people who come in and do their cardiac rehab after you've had open heart surgery or a heart problem that requires cardiac rehab. We have quite a few people that use physical therapy. Their physician from somewhere other than Leisure World sends them in here to have their physical therapy done. So there's much more available within the healthcare center than very many people realize. And those are some of the things that I wanted to bring out to you. And some of the things that I was explaining to this doctor that makes it special, makes it different from a lot of other places. We also provide transportation every hour from 9 in the morning, and the last run is 4 in the afternoon, that goes between the healthcare center and Los Alamitos Medical Center, and also makes a few other stops up there. That's a free service. As long as you get on the bus at 9, you can come back at 10 or go up at 11. We have people that do that when they go up to have tests done, when they go to visit someone. Or I had someone recently had no reason to go up there, they wanted to go shopping somewhere up there. So they just took the bus. That's wonderful. There's no restriction that says you have to absolutely take the bus to go to the hospital or to somewhere up there. It's just a ride up into that area, and as long as you meet the bus coming back. So then there's no charge for it. And this doctor looked at me and he said, "You don't charge for that?" I said, "No. No, we don't." He said, "We would like to do very much something like that, but it's a good 6 or 7 mile trip or more over to where they are." And he said, "Oh, well, we'd have to charge a little bit for that." And I said, "Well, you might want to think about it. It's a wonderful service." The bus that we have here also has the wheelchair lift. So if you're in a wheelchair, Julie, how many of you know Julie, our bus driver? She's a terrific person and drives that bus. She can put you in on the lift on a wheelchair, and you have now transportation again. Also, we have pre-registration direct into the hospital, which means that if you have to go to Los Alamitos Medical Center for any reason, for have a test done, or you have to be admitted for something that's not an emergency, you can go right into the healthcare center. The lady's name is Vicki Tracy. She will sit there. She has a direct line into the hospital computers, and she can pre-register you into the hospital so that when you are ready to go on whatever day that you have to go, you don't have to go through all that pre-admission work at the hospital. So when you get up there, everything is already done for you. That's another service you don't find in doctor's offices very often. Very few that I know of are able to register you right into the hospital, right into their computer, so all the information is there. We have a social services department at Leisure World who recently we have taken on Janice Derdarian, who's a licensed clinical social worker, who's going to be available to us 40 hours a week now from Monday through Friday. And she will be available to take care of social services issues. She recently did a presentation to the President's Council meeting on what her services are available. And I, for one, learned a lot. I did not know that she was able to do as many things as she did. And that's where she can become very important in conservatorships and in public guardianships. And she wants to begin to work very closely, as much as she can, again, with the mutual presidents, so that they know that her services are there when they need help, and she can hopefully, she's guided many of them in the right directions, helping people just get through simple things. And it doesn't necessarily have to be a health issue. It could be something simple as a bank account or a checking account. We've been asked recently to present a talk on fraud and abuse in the financial area. And so probably after January 1st, we're going to look to doing that. Maybe Golden Age would like to sponsor that for us. But we've been asked to do that, and she is more than willing to get some videotapes so that we can show some of the things to be aware of and to be careful of. So we have our social services available to us. We also have all the specialists available there. Now, some of them come down more than others, depending on need. For instance, we have ophthalmologists are there quite frequently. Those are the eye doctors. We have 3 of them now. We have 2 gentlemen and we have a lady who come down during the week, and they're there 16 or more hours at Leisure World throughout the week to provide eye services. And that does not include our optometrist and the optical shop. That's a very busy area. Again, you don't have to be seeing our ophthalmologist to come in and get your glasses. You can go in and use the optical shop without having seen, as long as you have a prescription. Again, though, you have to be aware is if the plan that you have signed up with to cover that, we are providers for. The easiest way to find that out is to call the healthcare center. And you have a choice. You can either call administration, which is where I am, and you can talk to Karen Edwards, who's my administrative assistant, or you can call the business office. And there's a supervisor over there. Her name is Donna Miller, and you can ask her. Or you can talk to Cynthia Diaz in patient accounting, which some of you may or may not know. She's been here over 20 years. And she will more than happily check out what plan that you've gotten and what services we can give you at Leisure World under that plan. And if we can't, advise you what you might do. Okay? Be mindful that we cannot advise you against selecting any one insurance plan. That's a personal decision that you need to do for yourselves. But we can give you avenues of ways that you can find out that kind of information. Besides the eye doctors, we have podiatrists that's here 5 half days a week. We have all the other specialists. We have the oncologists, we have the orthopedic doctors, we have the rheumatologist, neurologist, cardiologist. We have all the ologists. They come down here anywhere from 4 hours a week to 16 hours a week. And then we have the primary care doctors. We had 4. We now have 5. We've recently added Dr. Mary Sherman, who's with me today and is going to be talking to you shortly. She began with us on November the 1st. And that was in response to a need in the community. We were asked quite frequently, could we please have a lady primary care? So now we have a lady primary care. In with those primary care doctors, we also have a nurse practitioner. And we have a variety of mostly RNs working in the healthcare center. Most doctor's offices that you go to, you don't very often find registered nurses. You'll find medical assistants and you'll find LPNs who are all very qualified, don't misunderstand. But at Leisure World we have a need to have RNs, so we have mostly registered nurses. working in the clinic. Most of them who have been working with senior citizens for a very long time. Besides all of the nurses and the physicians who are all well-trained in dealing with senior citizens, most of the staff that we have tend to stay around a long time. I was very surprised to find when I came here. I'm used to working in doctor's offices and finding out that people stay for 2-3 weeks. Every time you go back, you see a different face. The nice thing about Leisure World, and I've been here 3.5 years, is you see very few different faces. You mostly see the same nurses, the same people working, and that's good because you can build up that relationship with them. Most people know most of our staff on a first-name basis and feel quite comfortable when they see them. So that's also different from a doctor's office. We have other services, as I was explaining to this doctor, that you wouldn't normally find, and those are 2 other services. One of them which is sponsored by Golden Age, and that's the Lifeline Monitoring Service. We have that service here. We monitor the lifelines out of the healthcare center 7 days a week, 24 hours a day. There is always someone there to monitor that lifeline. Physically there, physically sitting there, watching the monitor, listening for the alarm. And once that alarm goes off, that triggers an entire network of people. From the person who takes the alarm, to the emergency nurse that responds, to the medics, ambulance people if they're needed, to paramedics if they're needed. And that service is available to anyone. Regardless of whatever insurance plan you have signed up with, you can be part of the Lifeline program. There is a fee for it, but you can be part of the Lifeline program. We have over 400 of them out there in the community that we're monitoring on a daily basis right now. And tied in with that is the emergency nurse service. That's a service, and my understanding, has been around a very long time here. And it still is, exactly the way it always was. There are nurses available, registered nurses. They are all RNs. They are available during the day, in the evenings, nights, weekends, holidays, 24 hours a day, 7 days a week. They participate in monitoring the lifeline. They also respond to phone calls from the community for help. They also respond to the doctor's requests to go out and visit someone, because doctor feels that someone needs a visit or needs some attention. Now, anyone, again, as a resident of Leisure World, can partake in the emergency nurse service. That service, and I'd like to clarify this point if I may, that service is not covered by any insurance plan. And the reason why is because Medicare does not recognize that service. Okay? They recognize it only as a convenience, and Medicare does not pay for conveniences. It's not something you would find out if you were not living in Leisure World. Let's say you lived up the street in Rossmore. You wouldn't find that service. That is a unique service to Leisure World, because you are within a closed community and you have a central location where you can have this base station of nurses. And they are available, but they do charge. Again, they are all registered nurses. There is a fee for that. And that is your responsibility to pay, because no insurance plan, not even the HMOs, will recognize that. And I say that because there are some misconceptions because of the word emergency in there. And it may not be the best word to use there, but it's the one that gets its picture across. They are very often responding to emergencies. So they're available also, and that is something that you don't see. Now that's over and above home health care. That's different. When a home health nurse comes to your house because your doctor has ordered it, that's a different service. And that is covered by insurance plans in most cases. But this unique service that we have here at Leisure World that's available to you is something that's not covered by insurance plan, but it is there and available. And again, that's another thing that makes the healthcare center special and very different from a lot of other places. Does anyone have any questions for me? Would like to ask me anything?
Yes. Insurance for malpractice.
Yes, they are.
They are.
Yes.
They're not affiliated with HMO in particular.
They're not affiliated with any one HMO, no.
Because I
Okay.
don't have any HMO.
You don't have to be an HMO participant. If you have whatever your coverage could be, you could give us a call and we'll advise you on that as to what you can do.
Oh, I have a job to do. I'm
You
very
do.
pleased,
Okay.
But I don't belong to
You don't have to. You don't have to. HMO is an insurance benefit. It's an insurance plan. Health Net Seniority Plus is an insurance plan. We don't have any one HMO that directs the daily activities of the healthcare center. For instance, if you went to a Kaiser facility, okay, they direct all the daily activities. You wouldn't find a doctor that takes just Medicare working in a Kaiser facility. But you can here, because we're not governed by any one HMO. We sign contracts with these various plans so that we can take care of the members that sign up with them. Yes, ma'am.
With the billing problem, can we walk into the building and talk to the lady near the healthcare center and pharmacy?
Cynthia Diaz?
That other
Yes.
building.
Yes, the two-story building on the first floor, where it says patient accounting on there. She's in there 5 days a week, from 8:30 in the morning until, from 8 o'clock in the morning until 4:30 in the afternoon, and they close for lunch. But yes, you could take your billing problems in there.
Is there a fee for the social service department?
There is. There is. Now, but that depends. That depends. If social services, some of the services provided by social services are covered by insurance plans.
By health care?
Yes, ma'am.
Well, then what ones wouldn't be? And what ones would be?
If you were to belong to a plan for which we have no contract, such as Kaiser, or FHP, or SCAN,
And everything would be.
right, then Aetna Seniority Plus, Aetna Senior Plan or something like that is another popular one that someone asked me about recently. We don't have a contract with them. So if you wanted to come in and see one of our physicians or use our services, you would have to pay for that because you would be out of your network.
Yeah, but like health care, how much would they cover?
I can't tell you
I mean,
exactly.
would they cover everything, the social service department?
Not all of it, no. First of all, if you were part of Health Net Seniority Plus, you'd have to have your primary care physician authorize the service to go to social services. Okay? Social services, if it's a service that's purely a social service, what's a good example? Problem with the checkbook balancing or something of that nature. That's not covered by, that's not a medical necessity reason. Okay? They are available for that, but then there's a fee for that. Okay, and they're all different fees, and I don't want to get into quoting fees. Yes, sir.
If you had a 911 call and you had a critical heart problem, and you're taken over to Los Alamitos, would you be stabilized over there regardless of what you're in, or are you going to have to wait until you find out whether your medical plan is going to be paid for or not?
No, sir. It's an emergency. You would be stabilized there.
Okay.
And then when you're stable to be moved, then you would be moved to the facility where, let's say you were Kaiser or something and had to go there. Yes, absolutely. Yes, sir.
Go ahead.
I'm sorry.
You have 3 HMOs at the present time.
That's correct.
Do you plan to add any more?
We are looking into adding others. Exactly which ones, I don't know. There's a long process you need to go through before you can actually get a contract with that. There's a lot of investigations that have to be done.
How many are you looking, how many of you are you looking into?
I don't personally do the contracting, so I don't know exactly which ones and how many, although I do know that we're looking at some others. And I don't know which ones they are.
Are they coming in, are they coming in going to depend on the building being done?
No, sir. No. When we look out there to contract with an insurance plan, it's based on the need of the community, what the community needs, what the community wants.
Our HMO, when we signed up, when my wife just signed up, was quite anxious to get in, or would like to get in, and we could be asking about it. But we're somewhat warned. We can't come down there because our HMO doesn't cover the services we really
Right,
need.
right. If you'd like, if you give administration a phone call and tell them which plan that is. I very often have people stop in my office and say, we've just signed up with this plan or that plan. We do make a note of it. And then very often we will get calls too. But the contracting, the process is a long process to go through before you finally settle on them.
For practical medical purposes, being is another HMO, your center doesn't really, I can't get much down there for my critical health problem. In other words, when I cut my neck off, you're going to send me someplace else, or I want to just go see the doctor, I still have to go outside. You can name it a few things that you would do, but basically for medical problems, I've got to go outside.
Well, you need,
Or join- or
yeah,
join-
if you've joined it, you most of your care at an HMO is through your primary care physician.
That's right.
Okay, but if it's an emergency, let's say you've cut your leg badly and you're bleeding very badly, all right, you can call into the healthcare center and they will coordinate for paramedics or whomever you might need. Yes, they will do that. Yes, ma'am.
Are you talking to different HMOs or are you talking for health plans?
No, ma'am, I don't speak for anyone in particular. I want to say that once again. We are not ruled by any one HMO. No, any one HMO governs our daily processes and what we do. To us at the healthcare center, the HMOs being HealthNet or Secure Horizons are insurance plans. They do not own the clinic, they don't run it, they don't tell us what to do. We simply take care of the members that sign up with them. We have a contract with them to take care of their members.
What happens when you have a doctor that you want him to refer you to a specialist, and he says, oh, I can take care of that?
That's a question that I'm not a medical person, so I would refrain
Well,
from
what steps would I take to
answering
get a
that question.
specialist? What
What steps would you
Sure.
take?
Call my HMO?
You could if you're not happy with the services. Every one of them has
it's
what
not
they
that-
call a member services
It's not
person.
that you're not happy with the services. The primary doctors do not want to refer you immediately. Like you have to have their permission.
Well, when you sign up with an HMO, you are going that route. You are turning your care over to a primary care physician who will refer you out when they feel the need.
Yeah, if he feels like it,
Well,
or she.
that's a medical question. I'm not a medical person, so I would refrain from getting involved in that one.
If a resident's guest is taken ill, a child or an adult, can he use the clinic if the resident pays for it?
You repeat the question.
I understand what, if you have a guest in your home, a child, for instance, and this child gets hurt or ill, could they come and use the healthcare center if they pay for it? As a rule, no, because the way the guidelines are written is that you must be a resident. Okay? There have been times, which I must say, and I have not personally seen them, but there have been times when a child has been injured. And we have intervened in the process, at least to get 911 going, or to offer some kind of first aid, which we're not an emergency room, nor are we an urgent care center. We have done that with no problems, but since we don't normally or routinely treat children, it's best that if it's a severe injury, that I don't know. Is there any other questions? If not, I would like to turn the floor over to Dr. Mary Sherman, who is our newest primary care physician, and she would like to speak to you a little bit about her background, what her goals are, and what her plans for her practice here at Leisure World. So, and thank you all very much for your attentiveness.
Good afternoon. I just wanted to start by saying I just joined the Leisure World Medical Group, and I'm real excited to be here and Fortunately, they decided to close that facility, and I was offered another position at FHP, but decided that I wanted to look around for another position, and luckily I found this position because I really enjoy doing geriatrics. Like I said, I've been doing it since 1986. And I met the group of physicians here, and I was impressed by the quality of their background and their dedication to caring to senior citizens. And I liked the idea that it was a smaller group setting so I can get to know people much better. One of the problems with working in a large HMO is that so many people come and go, and like you said, the doctors come and go. Doctors are for 2 years and then they leave, and then people get pretty upset because they don't get to know their physicians or the staff that's taking care of them. Just wanted to just talk briefly about what my goals are in coming here. Sort of my vision as a geriatrician serving the Leisure World community. I guess my main goal is to really maximize the quality of life that people are living here, not just the quantity of their days. I mean, I want to take care of that too. I want to make sure that people have a good life while they're here, and that they're able to lead it and at as high a level, as comfortable with as least number of medical problems as possible. And I intend to do this as a partner with you. In other words, I need your feedback, and I need to educate you, and so that you understand exactly what's going on with your health care and your health problems, and try and do it without using a lot of medical double talk, so that you understand what I'm saying. I want to accomplish these goals by, number one, providing effective treatments for your medical problems. And that doesn't always mean doing everything that's possible. In fact, there's a lot of research to suggest that there are some tests and some surgeries that may actually do more harm than good. And so that's something that we have to sit down on an individual basis and try and chart a course for each person that comes in under my care, so that you get the most effective and up-to-date care. Number two, I want to intervene to improve function, your physical function, and prevent disability. And I think that's, in general, you're going to find that that's what geriatricians want to do. We want people to be able to go out and live their lives as fully as possible. And just aside, I was just reading an article about doing exercise therapy and Tai Chi with our head nurse Joan is doing, and how that's been effective in people in their 80s and 90s in helping reduce numbers of falls, and they've even done it in people in nursing homes, and found that people who were bedridden before are able to get up and start walking just with doing simple things like exercises for prevention. Number three, I'm very interested in relief of pain, which is something that anybody with chronic arthritis, a lot of chronic conditions suffer. In the last 2 years, I participated in a training program at City of Hope in pain control, primarily for malignant pain in that case, but I'm also interested in non-malignant forms of pain. I also have participated in hypnosis training programs. That's medical hypnosis, not doing anything crazy, but teaching people relaxation techniques and other things to help control pain and other symptoms that they have. And finally, I'm interested in preserving people's autonomy in their homes and their dignity. And especially in cases where people either temporarily or for long term have to be admitted to a nursing home. I think that as a physician, I need to work as their advocate to make sure they're getting the best possible care. Okay, and I just wanted to conclude by emphasizing that I'm really excited to be joining the Leisure World Medical Group, and I do share their dedication to providing quality health care to all the residents here. Any questions?
I just want to.
like that.
Yes.
Great, wonderful.
Okay, and I have my cards in the back, if you're interested.
Okay. Well, I want to thank Linda Heller for coming today and present her with this certificate of appreciation, and for bringing Dr. Mary Sherman to, so she can tell you about herself.